Breast lymph nodes examination. The lateral brachial humeral group, anterior or pectoral group, posterior group, central group, apical group, infraclavicular group, supraclavicular group, anterior breast lymph nodes. 4 to 5 nodes lying along the infralateral border of the pectoralis major, related to the lateral thoracic artery. The afferents drain the skin and the muscles of the anterolateral thoracic wall, as well as the central and lateral breast tissue. The efferents pass to the central and apical nodes, also called the pectoral, medial, and sometimes the inferior group. Posterior breast lymph nodes, a group of 6 to 7 nodes on the lower margin of the posterior axillary wall along the course of the subscapular artery. Its afferents drain the skin and muscles of the posterior thoracic wall, as well as the lower posterior part of the neck. The efferents pass to the central nodes. Also, it is called the subscapular nodes or the inferior nodes. Lateral breast lymph nodes, a group of 4 to 6 nodes, medial and posterior to the axillary vein along the lateral wall of the axilla. The afferents drain the upper limb except the superficial vessels around the cephalic vein. The efferents drain into the infraclavicular nodes, apical nodes, and central nodes of the axilla, as well as the inferior deep cervical lymph nodes. Also, it is called the humeral or the brachial group. The central breast lymph nodes, a group of 3 or 4 nodes in the adipose tissue at the base of the axilla. The afferents from the lateral, anterior, and posterior nodes. The efferents drain into the apical nodes. Also, it is called the intermediate nodes. The apical breast lymph nodes, a group of 5 to 10 lymph nodes, partly posterior and partly superior to the pectoralis minor. The afferents from the superior breast tissue, the mammary tail, and from all other axillary groups. The efferents unite to form the subclavian trunk. Infraclavicular lymph nodes, 2 or 3 nodes superior and posterior to the axillary artery and inferior to the clavicle. Afferents from the superficial vessels around the cephalic vein, and the efferents drain directly into the apical nodes, to which they are closely associated. The supraclavicular lymph nodes, a pair of nodes superior to the clavicle. The right afferents drain the right side of the chest, esophagus, and lungs. The left afferents drain via the thoracic duct, the abdomen, and thorax. The efferents drain directly into the subclavian trunk. The left group is called the Virchow group. The Virchow group may reveal secondaries of thoracic or abdominal malignancy. Upper limb lymphatic edema. Axillary nodes changes in the form of either enlargement or ulceration. Good luck and best wishes.